The stance phase occurs totally within the support phase. It encompasses the point at which the supporting leg contacts the treadmill surface and concludes as the support leg accelerates to toe off. The stance phase looks at the impact of foot strike in an active landing and the maintenance of forward momentum of the leg in swing phase. Swing phase looks at the biomechanical movement of the leg, not in support and/or stance phase. Not surprisingly, swing phase looks at the leg in the process of swinging forward. The swing phase prepares the leg for foot descent to hit the treadmill with an active landing. The analysis of swing phase involves an understanding of two terms, flexion and extension. Imagine bringing your hand back to your chest, keeping your elbow still. This muscle movement is flexion. Keeping your elbow still again, drop your hand towards your leg. This is extension. Stance phase starts with the first contact of the swing phase leg with the treadmill. This is a very short phase in which the foot should, ideally, hit the ground moving backwards. Whether the foot is moving backwards is dependent upon whether the runner is a fore or rear foot landing runner. The main function of this phase is impact absorption. Mid-support phase of the running stride occurs after the impact of the foot to the treadmill. This phase is characterized by hip, knee and ankle flexion and foot pronation. The degree and direction of pronation differs enormously among individuals. Pronation is the process of rolling in on the ankle, with supination the process of rolling out. The knee is normally slightly flexed at touchdown. The degree of flexion is dependent on running speed and level of fatigue, and its primary purpose is to absorb the shock of foot stroke. As you will see in the video analysis of the VO2 max test, there is an increase in flexion as the athlete tires and angle of inclination of the treadmill increases. Knee flexion occurs until the hip is roughly over the ankle. Knee extension then proceeds until toe off. The function of the mid-support phase is the maintenance of forward momentum, support of body weight, and storage of elastic energy. The takeoff component of swing phase is, as the name implies, that the foot is pushed from the ground in takeoff. The beginning of this phase, however, is when the lower leg and upper leg begin to straighten out in preparation for toe off. The straightening of the upper and lower leg is known as limb lengthening and occurs because of hip extension. During this lengthening phase, the hips and knees extend, the ankle flexes and the foot supinates. The function of takeoff is to accelerate the body forwards and upwards and to transfer energy from the powerful thigh muscles of the upper leg to the muscles of the calf in the lower leg. The process of follow-through begins at toe-off. This phase is characterized by slowing of hip extension. Hip extension is then followed by hip flexion. Both the hip extension and flexion assist the next process of knee flexion. Knee flexion is the end of this phase, which results in a deceleration of the recovery leg. The next phase in the swing phase is the forward swing. This phase begins with the recovery leg moving forward relative to the body. To do this, the hip flexes with the knee flexing or flexed. The main function of the forward swing is to coordinate the recovery leg movement to enhance the forwards and upwards movement of the leg. This forward and upward motion of the recovery leg is derived from the reaction force from the ground. Foot descent phase begins as the forward movement of the leg and foot wanes, then stops. The recovery leg forward swing is slowed and then stopped by the hamstring muscles. The hip and knee then extend and the gastrocnemius muscle at the back of the calf is pre-activated for landing. The end of this phase is with first foot contact. The main function of this phase is to have the foot strike the treadmill in an active landing and to prevent braking of the forward momentum of the runner.